open quote, "The thoughtless person playing with penicillin treatment is morally responsible for the death of the man who succumbs to infection with the penicillin-resistant organism." Close quote. Hi guys, welcome back to another episode of Nursing with Ingrid. Thank you so very much for stopping by yet once again to share space with me. I absolutely appreciate you. And once more, I'd like to say thank you to all my new subscribers. Thank you so very much and welcome to the family. Thank you very much for your subscriptions. I absolutely appreciate each and every one of you. You are helping this channel to grow and I'm absolutely grateful for it. Today we're going to be discussing antimicrobial resistance. The WHO has set aside one of the weeks in November in order to make awareness around antimicrobial resistance, and I am here to give you a little bit of information with regards to antimicrobial resistance. Antimicrobial resistance happens over time with the overuse or the excessive use of antibiotics, with the excessive use of antivirals, with the excessive use of antifungals or anti-parasitics. What happens is that over time, when we overuse our antibiotics or anything within the antimicrobial environment in order to treat infections, what happens is that with time those microorganisms or those bugs become resistant to the drugs that we have been using previously, which leads them to be more resistant with time towards those drugs, and they don't work effectively, and we end up with superbugs. And these are bugs that you will need a lot more medication or antimicrobials in order to stop the growth of the bacteria or the virus or the parasites or whatever it is that we are trying to treat. Just a few facts to touch on with regards to what exactly antimicrobial resistance does and what it is and what it's not. Antimicrobial resistance is something, like I said in the beginning, that happens over time, and that happens because we inadvertently, as human beings, we consume antibiotics in our food, in our meat, in our vegetables unknowingly, and with that we develop this resistance within our bodies where these bugs or these bacteria and viruses are able to mutate and be more resistant to our antibiotics or antimicrobials. What happens is that at the moment we are facing an absolute dilemma or a crisis with regards to antimicrobial resistance, because patients are coming in and there's more and more incidences or cases that are coming up where patients or infected persons are now not getting the proper treatment because the drug has just now, or the microorganism should I say, has just now mutated and is now immune to whatever treatment we present them. Another contributing factor to antimicrobial resistance is the lack of water, the lack of sanitation, as well as just personal hygiene. When those things are lacking, it becomes a little bit more difficult for us to do proper infection prevention and control, because we are, as we know at the moment, we are very much into hand washing, proper hand washing, sanitization of our environment, even though we are not in the critical spaces or we're not in the clinical spaces, but within our homes we are now disinfecting a lot more than we used to. So with the lack of those things being put in place, these bugs are able to grow and mutate, and with their mutation they also become resistant. So these are also things that add to this antimicrobial resistance crisis that we are facing as a nation and as the human race. Another fact about AMR, or antimicrobial resistance, is that it affects our economy, our global economy. And how does it do this? It affects our economy in the sense that we need to be in hospital for longer periods of time. It takes a lot more drugs to treat a certain infection, whereas previously you would use one drug. Now you're using a cocktail of drugs, and you're moving up the tiers of treatment. So our first line of treatment is now exhausted, and it's caused the bugs to be a little bit more resistant to those drugs. So you have to step it up, which becomes a little bit more expensive, and you've got to add other drugs to it to make a combination or a cocktail that is able to target or stop the growth of certain microorganisms or bacteria for that matter. Now, as well with the economy, when we are in hospital for a longer time, it means that we are not in the workplace, we are not productive, we are not in industry, we are not engaging in service delivery, whichever sphere you fall in, or whichever sphere you find yourself in. So the longer time you spend in hospital means that you're away from work, which also drops production on your work side. The economic effects are also seen within the healthcare industry, meaning our hospitals, our clinics, our GPs are now inundated with a lot more patients that are coming through that are ill, and the treatments that we are using are tearing up and becoming more and more expensive. If you're on a medical aid, it becomes a little bit more difficult, because then you're now using a lot more of your medical aid funds to treat something that maybe, let's say 5 years ago, was easily treated with one drug. With antimicrobial resistance as well, we find that our younger generation or the younger community are more prone to these superbugs, which makes it obviously very difficult to treat young children and young adults, because they have been exposed to these superbugs way early. So it also becomes very difficult to treat certain conditions, because now the public is now exposed to these superbugs that are absolutely resistant to most of the drugs that are out there at the moment. Another fact or another impact that AMR or antimicrobial resistance has is that it affects the fact that we are now very much unsuccessful in treating patients efficiently and effectively. So that in and of itself is crippling our health community or our health environment, because it's now more difficult to treat certain infections as opposed to a few years ago. So what are the different infections that we can have due to microorganisms? We have the bacterial infections. Your bacterial infections are things like your tonsillitis, your pharyngitis, your laryngitis, your sore throat. Those are all caused by your streptococcus infections, and those fall under bacterial. Okay, and then we have viral infections. These are the infections that are caused by viruses, and that is when we're looking at your hepatitis infections, we're looking at HIV infections, right? When it comes to your parasites, this is your malaria environment, where parasites now grow and within your body, and they make you ill. So that is an example of a parasitic infection. Then we have your fungal infections that is brought about by fungi, and that is your candida or your I want to say thrush, to put it bluntly. So that falls under the fungi infections. So now when we talk about antimicrobial resistance, we're talking about all these different bodies, or all these different modes of transport or mediums of infection, which means that it's covering the whole spectrum of infections that we can possibly be infected with. So if we just tone down on accessibility of antibiotics, that will help in the long run over a longer period of time. With antibiotics as well, we need to remember that you need to take the full course and complete it. You need to take it as prescribed by your doctor or as prescribed by your health provider. Another thing with antibiotics that we have to do is let us not share antibiotics, please. If you're sharing your antibiotics, it means that you did not finish your course. And with you not finishing your course of antibiotics and you have a few pills left and you're giving it to somebody else. We also see this with the treatment of TB. Many patients default on their medication. They don't take it as prescribed because it makes them feel very bad. It makes them feel absolutely bad. And then with time, you find that they become resistant to the very same drugs that will help them, and then you end up with a multi-drug resistant TB. And with that, that is longer and more difficult to treat. The patient is in hospital for a longer time. They need more invasive procedures in order to get the medication in. That is by putting in central lines, that is by putting in PICC lines and stuff like that, in order for them to get their medication and for it to be effective. So when it comes to our treatment, please, my beloved human beings, my fellow human beings, please let us complete our courses of treatment, whatever they are. Let's take them at the right time, always and every day, without fail. And that will help the world in ways that you cannot imagine. To wrap up this video, I just want us to be a little bit more conscious of the drugs that we take. Let us all be responsible when we are prescribing drugs or when we are given drugs, prescribed drugs to take. Take the full course, stay loyal, stay faithful to your treatment plan, and that will help us a lot. Let me know your comments down below. If you like this video, please give it a massive thumbs up, and I will see you in the next video. Please do take care. God bless. Bye-bye.